70-year male who is a known case of hypertension and diabetes has history of primary open angle glaucoma since last 5 years, and his IOP even with the drops is 26-27, uncontrolled, and vertical cup disc ratio is 0.9. Field is showing inferior field defect, arcuate defect, and confrontation field test also showing the field loss in the inferior area. Disc is showing vertical disc height 1.4 with cup disc ratio 0.9, and inferior rim is completely eroded, violating the ISNT rule, and it is advanced glaucomatous disc. He was undergone trabeculectomy in the both eyes, and wound is healthy, bleb is seen. 7 parameters to look for: disc size and shape, neuroretinal rim size, shape, pallor, ISNT rule, cup size and shape in relation to optic disc size, vertical CD ratio, cup depth excavation, and optic disc hemorrhage presence and its location. Nerve fiber layer defect, whether focal or diffuse, peripapillary atrophy, size, location and configuration, and retinal artery attenuation, whether focal or diffuse. Large disc will have large cup, small disc will have small cup or no cup. So we have to measure the disc diameter. Length of the vertical beam of slit lamp multiplied by 1.5 is the correction factor, give the height of the vertical disc. Early and moderate glaucomatous damage in small disc may be missed because of erroneously low cup disc ratio, because small optic disc have small cup or no cup. Next is vertical cup disc ratio. In normal eyes, horizontal CD ratio more than vertical CD ratio. In glaucomatous eyes, vertical CD ratio is more than horizontal CD ratio. Next is neuroretinal rim. Size, shape, pallor and ISNT rule. Inferior is more thicker, followed by superior, followed by nasal, followed by temporal. The glaucomatous rim loss usually sequences inferotemporal, superiotemporal, horizontal temporal and inferonasal. Thinning of NRR and pallor of NRR and notching. If there is notching is there, it is mostly of glaucomatous, and optic disc hemorrhage is hallmark in case of glaucoma. Retinal nerve fiber layer defect seen as bright fine striations fanning out from disc to the periphery. Localized RNFL, focal type of NTG, and diffuse loss of RNFL is more difficult to see. Peripapillary chorioretinal atrophy, beta zone and peripheral alpha zone. Beta zone is more affected in the glaucomatous chorioretinal atrophy. Retinal artery attenuation, diffuse narrowing and focal narrowing. Focal narrowing more common in NTG.